Yeah, just a quick review of the PushMed knee brace. So this brace is made specifically for people that have knee pain or some type of knee problem. And the idea here is that you put on the brace and it supports the joint, it supports the muscles around the knee, so that way your knee has a chance to rest, recover, and doesn't get so overstressed as you do things. So a few points about this particular brace. This is actually one of the more unusual braces that I've looked at because of this on the side. Basically, it's got this, I'll say, this spring hinges, I think is what they call it, on each side. Now, it's very flexible when you bend your knee. So this thing, you can bend your knee all the way, but that'll provide some resistance. So it is actually supporting that motion somewhat. Basically, it's giving you good side-to-side stability too. So if you need any of that, I think this is a good brace. The other thing I really like about it is that it's machine washable. I mean, and that's not really anything to be, overlooked. You wear these braces when you're really active, like doing sports or you're, out there gardening or something, especially in the summer months. As you do these things, you're going to start to sweat. And after a while, the brace is going to, pick up sweat. It's going to start to smell. And then you have to worry about washing the thing. So it's nice that this isn't a hand wash only brace. Okay, this is totally machine washable. Well, that's a big plus. So anyway, other things you can do if you have knee problems, just get this from this resource, Bulletproof Your Knee. If you have any kind of knee problem, make sure that you strengthen your quadriceps muscle. Your quadriceps muscle is a big muscle on the front of your leg. Here's your kneecap for reference, and right above it is your big quadriceps, made up of actually 4 different muscles. They usually just call it the quads or the quadriceps. What they're finding is that when you have certain knee problems, actually a bunch of different knee problems, when researchers go look at people with these knee problems, they find that selectively it's just the quads that has decreased strength in it compared to the other muscles around the knee. So for instance, knee swelling in the quadriceps, another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscles. None of the other muscles, just your quads. Knee injuries in the quadriceps, another thing that researchers have looked at, various knee injuries, broken your lower leg bone, your tibia. If you had surgical opening of the joint, knee surgery, they find a lot of times these people have decreased quadriceps strength. Ligament problems in the quads, anterior cruciate ligament, that would be your ACL. Your football players are injuring their ACL. So for instance, one study looked at people that completely ruptured their ACL. Researchers found that the strength of the quadriceps muscle in the injured leg was decreased by 25 to 30%. So this is a muscle that really stabilizes your knee. And if you take it down 25 to 30%, you're really compromising a lot of knee stability. So it's hard to get better and get pain-free if you have that kind of strength deficit. Same thing with the posterior cruciate ligament, medial collateral ligament, all those ligaments are around the knee. Knee pain in the quadriceps, they find that people that have, for instance, pain, it just kind of doesn't really, sometimes it can actually, I won't say shut down the quads, but basically it's associated with decreased quad strength. Knee arthritis in quadriceps. So if you Google like knee arthritis and quadriceps muscle, just basically every study that you look at is going to show that people with knee arthritis have decreased quad strength. And likewise, there are randomized controlled trials showing that if you take a group of people with knee arthritis and you strengthen just their quads, their knee pain starts to go away. And the other thing that they found in the literature is that the people with the stronger quads that have knee arthritis, they have less progression of their knee arthritis. So it actually kind of interrupts the pathological process. Patellofemoral pain syndrome in the quadriceps, the list just goes on and on. So if you have any kind of knee problem, make sure you're doing at least one exercise to strengthen those quadriceps muscle. Fine-tune control over your knee. Here they're talking about the hip muscles. Sometimes you have knee pain. There's absolutely nothing wrong with your knee, but the problem's up at the hip. So for instance, classic cases, people have iliotibial band syndrome. Take a group of people with iliotibial band syndrome, like researchers have done, and you test their muscles. You find they have really unusually weak hip abductors. That's a muscle here, one of them that keeps your pelvis level every time you take a step. Brings your leg out to the side. Likewise, here again, like with knee arthritis, you take a group of people with iliotibial band syndrome. There's a randomized controlled trials now. You strengthen their hip abductors, then the iliotibial band syndrome goes away. So interesting. Optimize knee flexibility. We all know that you need to keep your knee needs to be able to bend and straighten sufficiently. What a lot of people don't know though is that your knee actually rotates. I know that may sound funny, but about the last 10 to 15 degrees of you straightening your leg, it actually rotates laterally out to the side. So that's an accessory motion. Here's a little test to see if you have that. That's an accessory motion you really need to have a fully functioning knee. So other stuff you can work on to get pain-free. Increased dynamic knee stability. Here we're talking about proprioception. So for instance, proprioception is your position sense. So if I suddenly turn off the lights, you'd probably be able to tell me if your knee is bent or straight. That's because you have joint receptors and receptors in the muscle that give your brain constant feedback as to where your knee is in space. What they're finding is that people with some knee problems, certain knee problems, have decreased proprioception. And it's not like they don't know where their knee is or anything, but it's just not up to what it should be doing. And that has consequences for, like, let's say you're stepping off a curb unexpectedly and you weren't ready for it. You need to know where your knee is precisely so that you can contract the muscles like your quads and support it before it hits the ground. So we're talking, milliseconds. So anyway, other stuff you can work on. But yeah, nothing's as quick as putting on a brace. A lot of people who put on a brace, they have instant relief of their knee pain. So yeah, this is a good brace. Check it out.